An 80-year-old unconscious female was brought to the emergency department by the emergency response team. The patient has an intravenous line, and she is also hooked to a biphasic defibrillator. You are told that she was found unconscious in bed. You get the following vital signs. Heart rate equals 42 beats per minute. Respiratory rate equals 25 breaths per minute. Blood pressure equals 80/60 millimeters of mercury. Temperature equals 36.8 degrees Celsius. You note the following ECG tracing. Question 1. What is the ECG finding? A. Normal sinus rhythm. B. Premature junctional beat. C. Idioventricular rhythm. D. Sinus bradycardia. Correct answer, D. Sinus bradycardia. The presence of a P wave
and a regular RR interval
makes this ECG finding a normal sinus rhythm, but since the heart rate is in the 40s, it is known as sinus bradycardia. Question 2. What should you do next? A.
Administer amiodarone,
150 milligrams intravenous infusion over 10 minutes. B. Administer atropine, 1 milligram intravenous bolus. C. Defibrillate. D. Administer adenosine, 6 milligrams intravenous, followed by a 20 milliliter saline flush. Correct answer, B. Administer atropine, 1 milligram intravenous bolus. The American Heart Association guidelines for bradycardia with a pulse suggest that when a patient has acutely altered mental status and hypotension, the most appropriate choice of treatment is atropine. Incorrect answers: amiodarone is an antiarrhythmic potassium channel blocker with calcium and sodium blocker properties. It will potentiate the effects of bradycardia. Never defibrillate a patient with a pulse. Adenosine is the pharmacologic treatment for narrow QRS complex tachyarrhythmia with regular RR intervals,
such as paroxysmal supraventricular tachycardia.
After your initial management, you check her vital signs and cannot feel a pulse. Blood pressure cannot be measured, and there is no spontaneous breathing. You check the ECG monitor and find the following tracing. Question 3. What is the ECG finding? A. Atrial flutter. B. Ventricular tachycardia. C. Idioventricular rhythm. D. Ventricular fibrillation. Correct answer, D. Ventricular fibrillation. Ventricular fibrillation is a very rapid rhythm with no QRS complex and absent P waves. In ventricular fibrillation, there is disorganized electrical conduction throughout the heart. Depolarization and repolarization are occurring at the same time, which prevents the pumping function of the ventricles. Question 4. What is the next most appropriate action? A. High-quality CPR for 2 minutes. Administer epinephrine 1 milligram IV bolus, followed by 20 milliliter saline flush. B. Apply advanced airway with waveform capnography. C. Defibrillate. D. Intravenous administration of atropine, 0.5 milligram bolus. Correct answer, C. Defibrillate. American Heart Association guidelines recommend early defibrillation once ventricular fibrillation is documented. Question 5. What is the next most appropriate action? A. High-quality CPR for 2 minutes. B. Insert an advanced airway with waveform capnography. C. Defibrillate. D. Intravenous administration of atropine, 0.5 milligram bolus. Correct answer, A. High-quality CPR for 2 minutes. This is the next step after defibrillating the patient. After performing your previous intervention, you observed the following rhythm. Question 6. What is the next most appropriate action? A. Defibrillate. B. Administer atropine, 0.5 milligram intravenous bolus injection. C. Administer transcutaneous pacing. D. Check vital signs. Correct answer, D. Check vital signs. Always check the patient first for signs of improvement to know the next most appropriate action to take. Checking her vital signs, you do not feel a pulse. Blood pressure cannot be measured, and there is no spontaneous breathing. You again check the cardiac monitor. Question 7. What is your assessment? A. Agonal rhythm. B. Premature atrial beat. C. Idioventricular rhythm. D. Pulseless electrical activity. Correct answer, D. Pulseless electrical activity. It is important to check the patient and record her vital signs after each step in the algorithm. Question 8. What is your next appropriate action? A. Continue CPR for 2 minutes, followed by epinephrine 1 milligram intravenous bolus every 3 to 5 minutes. B. Defibrillate. C. Administer transcutaneous pacemaker. D. Administer atropine 0.5 milligram intravenous bolus. Correct answer, A. Continue CPR for 2 minutes, followed by epinephrine 1 milligram intravenous bolus every 3 to 5 minutes. Pulseless electrical activity is not a shockable rhythm. Hence, the healthcare provider should continue CPR with the administration of epinephrine 1 milligram intravenous bolus every 3 to 5 minutes. After performing your previous intervention, there is still no change in the condition of the patient, and you still have the following ECG finding. Question 9. What should you be considering during this time? A. Halt resuscitative efforts and declare the patient deceased. B. Seek expert help immediately. C. Defibrillate. D. Continue CPR and apply advanced airway with waveform capnography with the administration of epinephrine. Correct answer, D. Continue CPR and apply advanced airway with waveform capnography with the administration of epinephrine. Following the AHA guidelines, this is the next most appropriate step. It may also be appropriate to consider the placement of advanced airway and waveform capnography. It is not appropriate to halt resuscitative efforts since this is only the second round of CPR. After performing the previous management, you observe the following rhythm. Question 10. What is your next appropriate action? A. Continue CPR for 2 minutes, followed by epinephrine 1 milligram intravenous bolus every 3 to 5 minutes. B. C. Defibrillate. D. Synchronized cardioversion. Correct answer, C. Defibrillate. Ventricular fibrillation is a shockable rhythm. The energy must be the same or higher than the previous defibrillation. After your previous intervention, the patient has a palpable pulse. You check the ECG monitor and find the following. Question 11. What is your interpretation of this ECG finding? A. Ventricular fibrillation converts to ventricular tachycardia. B. Ventricular fibrillation converts to supraventricular tachycardia. C. Ventricular fibrillation converts to atrial fibrillation. D. Ventricular fibrillation converts to sinus tachycardia. Correct answer, D. Ventricular fibrillation converts to sinus tachycardia. This corresponds to successful defibrillation. The ECG tracing shows P waves, normal QRS complex, regular RR interval, followed by a T wave. Question 12. What is your next course of action? A. Defibrillate. B. Administer atropine 0.5 mg intravenous bolus injection. C. Seek expert consultation. D. Administer transcutaneous pacing. E. Check vital signs. Correct answer, E. Check vital signs. Always check the patient after performing a stage on the algorithm. You check the vital signs and find the following. Heart rate equals 140 beats per minute. Blood pressure equals 80 over 60 millimeters of mercury. Respiratory rate is 12 per minute. Temperature equals 36.1 degrees Celsius. The patient is still incoherent. You prepare the patient for the ICU. Question 13. Following American Heart Association guidelines, what have you achieved at this time? A. Successful resuscitation. B. Return of spontaneous circulation. C. Cardiac revival. D. Resumption of sustained cardiac function. Correct answer, B. Return of spontaneous circulation. American Heart Association guidelines suggest the return of spontaneous circulation if a cardiac arrest patient has regained a pulse and blood pressure, and if waveform capnography is being measured, a sustained increase in PETCO2 if greater than or equal to 40 millimeters of mercury.